Well, spring officially starts on Monday, but many of us have been feeling the symptoms of spring allergies for weeks now.
That's the truth. You know the drill: sniffling, sneezing, and itching and rubbing of the eyes. Here to help us through it is Dr. Michael Falcone with Charlotte Eye, Ear, Nose, and Throat Associates. Dr. Falcone, thank you so much for being here today.
Indeed.
Thank you. I'm honored to be here.
Of course. Certainly spring allergy season has already sprung. There's so much pollen. You're seeing a lot of patients right now, right?
That's correct. The allergy season started early this year. Mother Nature started spring off before Monday and the official start. But yeah, things have already picked up quite a bit at the office.
Yeah, the pollen is heavy right now, isn't it?
Yeah, actually, I look to Larry Sprinkle and the weather team every morning to let me know what the pollen levels are.
Very good. That's a good man right there. It's a smart doctor.
True.
Yeah.
I watch
I don't know if it's pollen, I don't know if it's what's in the air, but how do I know what I'm allergic to?
The best way, if you're somebody that has frequent suffering, you should consider allergy testing. There's a couple of different ways of being tested. There's typically what's most often done is a skin test. There's also a blood test too. The skin testing allows the individual to find out right then what they're allergic to.
Yeah, everyone in my family's had that done, know all about the skin test. What are some ways to treat our symptoms and to treat spring allergies?
Well, really, for treating any allergy, there's three ways of doing it. Avoiding the things that you're allergic to, allergy medicines, and then immunotherapy. As far as avoiding spring allergies, it's kind of hard to do once you step outside your front door. When I first moved to Charlotte, I made the mistake of sleeping with my windows open one night, and the next morning I saw pollen covering everything in the bedroom. But I learned from that. And so for individuals that once you go outside, if you come home, if you take a shower, change your clothes, that can make a really big difference. Making sure that if you avoid dining outside, those kinds of things, you can help reduce your exposure. But when that isn't enough, certainly allergy medicines and immunotherapy can also help.
So you just got finished saying, if you can't get over-the-counter stuff and it doesn't help you, what is immunotherapy? What is that?
So there's basically three different types of immunotherapy that are available nowadays. What most people think of when they think immunotherapy, they think allergy shots, and that's by far what's most commonly out there. And allergy shots basically train your immune system to behave differently when responding to those allergens, so you don't have the typical response. They're very effective for treating allergies. In fact, the experts say that allergy immunotherapy, whether it be shots or what have you, is actually the most effective way of treating allergies.
Once you start allergy shots, how long do you have to get them? Like, what is that process? I know when you initially start, you go once or twice a week, right? And then you kind of taper off.
Correct. Yeah, that's typically weekly. There's lots of benefits to allergy shots. Not only are they very effective, but one potential benefit is that they could actually cure you of your allergies.
Really?
Yes. And so that's the part we don't understand quite as well, because some people are able to come off treatment eventually and their symptoms stay away. Other people, though, once they try to come off, their symptoms just come right back, and we just simply don't understand why that might be the case in some individuals. Typically, though, the immunotherapy takes 3 to 5 years of having that exposure in order to even try to come off of it to see if you're actually cured.
Okay, what about different treatments like tablets?
Yes, and so the other things that are out there for immunotherapy, there are a couple of products now that are for grass pollen as well as weed pollen that are a tablet that you just put in your mouth to dissolve. You may have heard people say, oh, try local honey. Same sort of thing.
Yes, I heard that.
Yes, and so it's basically they're putting it into a tablet form that then just melts in your mouth. And that's a great option for patients if that's like their primary season that they're affected and they don't typically have symptoms year-round. It can be really helpful during the summer for grass pollen sufferers and during the late summer and early fall for weed pollen sufferers.
What about for those itchy eyes? Do you recommend eye drops? Does that work?
Well, even some of the oral medicines can help with eye symptoms, but certainly there are over-the-counter allergy eye drops, but then there are prescription ones that are also available too.
My goodness.
There's help out there. If you're suffering from allergies, call him. You can contact Charlotte Eye, Ear, Nose, and Throat Associates. The number on your screen, it is 704-295-3000. 704-295-3000. Or visit goodsenses.com. goodsenses.com. I know a lot of folks have a lot of success with allergy shots. Might be something to consider. Thank you, Dr. Falcone, for being here today.
Thank you so much for having me.
Indeed.